Patient engagement is a popular buzzword that is common in today's healthcare settings. But what does patient engagement mean? And how can we use patient portals to promote engagement? Hello everybody, my name is Daniel Couch, and for my presentation, I will be discussing how the use of patient portals can empower patients to be more involved in their own healthcare. I chose this topic because I help implement the portal in my organization, and I see all the benefits it offers our patients and providers. The objectives in this presentation include the following. Number 1, give a background into patient portals and discuss their rising popularity. Number 2, describe the features and benefits of using portals to provide insight into how this technology is being used today. Number 3, I want to define patient engagement. Number 4, I want to explain how using portals can empower patients to take a more active role in their healthcare. And finally, I'd like to show how providers can also benefit from patient engagement. A patient portal is a secure online website that gives patients convenient 24-hour access to personal health information from anywhere with the internet connection. The use of patient portals began in the late 1990s. However, widespread adoption did not begin until 2009 when the federal government invested $19 billion into health information technology. This investment, known as the American Recovery and Reinvestment Act, requires participating providers to meet specified meaningful use metrics to receive Medicare and Medicaid incentive payments. As part of Meaningful Use 2 requirements, eligible providers must have 5% of patients view, download, or transmit data through the patient portal. Patient portal adoption is becoming increasingly popular across the healthcare industry. According to ONC, around 70% of hospitals and physician offices offer some portal functionality. This growth is not only attributed to CMS's meaningful use requirements, but also the growing popularity of smartphones. According to a 2016 HIM survey, 58% of providers communicate with patients through mobile optimized portals. Patient portals offer a wide variety of features and are constantly being updated with new functionality. The most popular features of today's portals include the ability to view lab results, refill medications, communicate with the provider via secure messages, and update incorrect items in their medical record. Portal innovations that are gaining prevalence include the ability to upload data from wellness apps, telemedicine visits, and email visits. Some patients can even use the portal to check in before an appointment, update demographic information, and make payments in advance of their appointments. Now that we've discussed patient portals, I'd like to turn my attention to patient engagement. According to HIMSS, patient engagement is defined as providers and patients working together to improve health. A patient's greater engagement in healthcare contributes to improved health outcomes, and information technologies can support engagement. Patients want to be engaged in their healthcare decision-making process, and those who are engaged as decision makers in their care tend to be healthier and have better outcomes. Simply put, patient engagement seeks to empower patients to take a more active role in their healthcare. Here are some of the benefits of improved patient engagement. Number 1, it increases knowledge and understanding among patients and encourages them to become actively engaged in their health, leading to improved care. Number 2, by increasing communication through the use of technologies, physicians and patients can communicate with one another more often and provide updates or changes on the patient's condition. And finally, as communication improves, patients form a better understanding of their health conditions, which in turn increases patient satisfaction. The use of online portals support the idea of patient engagement in the following ways. Patients are more likely to see a doctor if they can book an appointment online. In my clinic, patients can spend extended amounts of time on hold waiting for assistance. If we had integrated scheduling functionality, it would decrease incoming phone calls and increase the likelihood of patient booking an appointment. It gives patients after-hours access to medical records. So for example, you're a parent that remembers you need a child shot record on the Sunday before school. If you had portal access, you could print the shot record online without any missed time at work or school. It gives patients the ability to have the records follow you from place to place. Some portals offer the ability to transmit data via email to other providers. And according to a 2016 HIM study, 80% of people under the age of 30 prefer to communicate through text messages. So these patients are more likely to ask the important questions of their providers if this functionality is available. The implementation of patient portals has a positive effect for providers as well. The ability to send a secure message, refill prescriptions, and request appointments online can reduce the amount of phone calls received by providers' offices. Portals can improve patient communication documentation by saving online conversations as secure health messages in the patient's medical record. They also reduce the no-show rate by sending appointment reminders to patients ahead of their appointments. Improved communication betters a patient's understanding about their care, which in turn improves patient satisfaction scores. As satisfaction scores increase, so do the scores in value-based programs, which enables practices to maximize reimbursements. In this slide, I'd like to describe how providers can encourage engagement by boosting the patient portal enrollment in their clinic. First, you should choose the functionality that will benefit your patient population the most. For example, if your clinic receives a high volume of phone calls, you can incorporate scheduling features into your portal to increase the likelihood of adoption. Second, clinics need to actively promote the portal. You can't just rely on pamphlets and signage to encourage enrollment. Active promotion starts during registration when the email is captured, reinforced by the nursing staff, and discussed in detail with the provider. In my facility, providers make all patients aware that the preferred method of communication is through the portal, so sign-up is mandatory. Third, clinics should facilitate easy enrollment by enabling auto-invitation features. With auto-invites, you do not need to rely on patients to actively go to a website to create an account. You can automatically send them an email upon their arrival and provide face-to-face assistance with the sign-up process. Fourth, you should allow portal access for caregivers. So if you're an office that sees a high volume of pediatric patients, it may be beneficial to provide portal access to their parents. Finally, you should integrate data collected from wellness apps. Today, nearly all patients have a smartphone, and a high percentage of us use this technology to collect data from wellness applications. By allowing patients to incorporate this data into their personal health record, you will increase the likelihood that they will create and engage with their portal application. Thank you for taking the time to review my presentation on increasing patient engagement through the use of patient portals. I look forward to watching your presentation and wish you the best of luck for the remainder of the semester.